What is air trapping on COPD expiratory court scans? Imagine trying to squeeze a sponge full of water, but some parts just won't let go. That's similar to what happens in the lungs of someone with chronic obstructive pulmonary disease when they breathe out. When a person with COPD exhales, normally the lungs should empty most of the air, making the lung tissue denser on a scan. But in COPD, some areas of the lungs trap air and don't fully empty. On an expiratory computed tomography scan, these regions look less dense than they should be. This is because the trapped air keeps those parts of the lungs inflated, even during exhalation. The scan shows these areas as patchy or lobular regions with lower attenuation, which means they appear darker compared to the rest of the lung tissue. This trapped air happens because small airways become narrowed or blocked, making it hard for air to escape. It is a sign of small airway disease, a key feature of COPD. During a standard scan, images are usually taken when the lungs are fully inflated. But for an expiratory scan, the patient exhales and holds their breath. The lungs should become denser as air leaves, but in COPD, some parts stay less dense because of trapped air. Doctors compare the density of the lungs during inspiration and expiration to see how much air is being trapped. They often measure lung attenuation values, with specific thresholds like -900 to -950 Hounsfield units, to identify air trapping. This measurement helps distinguish air trapping from emphysema, which also causes low attenuation but involves destruction of lung tissue. The amount of air trapping seen on these scans can tell doctors how severe the airway obstruction is. It also helps predict how quickly lung function might decline and whether the patient is at higher risk for flare-ups. Because of this, expiratory court scans offer more than just a picture. They provide functional information about how well the small airways are working. In simple terms, air trapping on these scans shows where the lungs are not emptying properly because of narrowed or blocked small airways. This makes it a useful tool for diagnosing and staging COPD, giving a clearer picture of the disease's impact on lung function.